60 million. I mean, just let that number sink in for a second. 60 million. That's how many adults in the United States experienced some form of mental illness in 2024 alone. We're talking about nearly 1 in 4 adults. When a number is that absolutely massive, it's not just a personal struggle anymore. It is a structural reality of our society.
Welcome to this explainer. I am so glad you're joining us today because we're going to take that 60 million and look at it not just as a clinical health statistic, but as a community. We're exploring mental health in the USA through a really crucial lens, the intersection of disability, visibility, and civil rights. We'll trace this incredible journey from how these conditions are defined by federal law all the way to how they're actually experienced by real people, at school, at work, and in the healthcare system.
Here's our roadmap for today. 1. Redefining mental health. 2. The fight for rights. 3. The access crisis. 4. Work and campus barriers. And finally, 5. The data disconnect. Okay, let's jump right into Section 1, redefining mental health.
To really grasp what's at stake here, we actually need to look at the Americans with Disabilities Act, or the ADA. Under the law, a mental health disability is defined as a persistent psychological disorder or emotional illness that substantially limits one or more major life activities. So why does that matter to us? Well, the absolutely crucial point here is that conditions like major depression, bipolar disorder, or schizophrenia, they aren't just medical issues. They are legally recognized as fundamental disability rights issues. Under the law, folks experiencing these conditions are entitled to protections against discrimination, and most importantly, they have a right to equal access.
And this touches different communities in very different ways. Looking at this data from the Disability Rights Education and Defense Fund, you can see some striking intersectional disparities when it comes to serious mental illness. Notice how the prevalence for Latino and American Indian or Alaska Native populations hovers around that 3.5% to 4% mark. But check out that bottom row. For multiracial individuals, people of 2 or more races, that rate skyrockets to 8.9%. That's more than twice as high as the baseline for non-Hispanic whites. It just goes to show, disability and mental health do not exist in a vacuum, right? They are deeply intertwined with our demographics and our social fabric.
Moving right along to Section 2, the fight for rights.
Now, those legal protections we just talked about, they didn't just magically appear on paper. They were fought for intensely by real people. Let's walk through how this momentum built over decades of relentless on-the-ground activism. Back in 1973, the Rehabilitation Act was passed, and Section 504 specifically outlawed discrimination based on disability. But, as we all know, passing a law and actually enforcing it are two entirely different things. So, by 1977, regulations were totally stalled. This led activists to stage massive sit-ins at federal buildings, most famously in San Francisco, demanding real action. Fast forward a bit to 1988, and you have the incredible Deaf President Now protest at Gallaudet University, where students successfully demanded leadership that actually represented their deaf student body. And then we get to 1990, with the truly iconic ADA Capitol Crawl. Activists quite literally abandoned their mobility aids and crawled up the steps of the U.S. Capitol. They did this to demand the passage of the Americans with Disabilities Act.
To really ground us in that history, I want to share a quote from Michael Winter, an activist who is actually there, participating in the Capitol Crawl. He said, "Some people may have thought it was undignified for people in wheelchairs to crawl, but I felt that it was necessary to show the country what kinds of things people with disabilities have to face." That right there is the visceral, deeply human reality of this movement. They took their invisible or often ignored struggles and made them highly unavoidably visible right on the steps of federal power.
Which brings us to Section 3, the access crisis.
So with all that history in mind, where are these hard-won legal protections falling short today? Well, despite the ADA and modern parity laws, 9.2% of adults with any mental illness are sitting here today completely uninsured. To put that into perspective, that translates to over 5 million people in the U.S. who have a mental health condition but absolutely zero health insurance to help them manage it.
And when you look at how this plays out geographically, a really clear disparity jumps right out at you. Basically, the darker the green, the higher the uninsured rate. Notice how 9 of the states with the highest rates of uninsured adults are heavily clustered right down in the southern U.S. In Texas, for example, nearly 1 in 5 adults with a mental illness does not have health insurance. Think about that. Your zip code is literally determining your access to your civil right to care. But here's the kicker. Even if you are lucky enough to have insurance, you run straight into this alarming ratio, 320 to 1. In the United States, there is just 1 mental health provider for every 320 individuals. Just imagine trying to manage that national shortage. You can have the absolute best civil rights laws on the books, but if there physically aren't enough doctors, counselors, and psychiatrists to actually see the patients, the whole system is just fundamentally bottlenecked. Let's look at how this plays out in everyday life in Section 4, Work and Campus Barriers.
This systemic bottleneck we just talked about, it doesn't stay neatly confined to the doctor's office. It bleeds out into a massive employment gap. For adults without disabilities, the full-time employment rate sits at about 61.7%. But for adults with significant psychiatric disabilities, that number plummets to 38.1%. We're looking at a system that effectively keeps the psychiatric disability community economically marginalized. I mean, when you combine severe provider shortages with a serious lack of workplace accommodations, securing and keeping full-time employment becomes an incredibly steep hill to climb.
And we're seeing these exact same institutional barriers replicating themselves right on our college campuses. A study by the National Council on Disability found that students seeking help face an absolute gauntlet of hurdles. It's not just the notoriously long wait times for counseling, though don't get me wrong, that is a massive issue. We're also talking about literal physical barriers to accessing the counseling centers themselves. There's a severe lack of cross-cultural training to properly support students of color or undocumented students. And there's a dramatic shortage of counselors who are fluent in American Sign Language. So universities are really struggling to support their students' diverse mental health needs, which is just pouring gasoline on an already severe campus mental health crisis.
This leads us to our final part, Section 5, the data disconnect. Now, you might be wondering, if we know all of this, why isn't the federal government throwing everything they have at fixing it? Well, we have to zoom out and uncover a massive systemic federal blind spot. You see, federal funding for disability programs relies heavily on survey data, specifically a set of questions known as the Washington Group Short Set, or WGSS. But a recent study published in Frontiers revealed a pretty shocking reality about how these surveys actually work. When we rely on these standard questions to identify folks with serious mental illnesses, we're talking conditions like schizophrenia or severe bipolar disorder, the surveys completely drop the ball. The question about concentration misses 66.2% of people with serious mental illness. The self-care question misses 88.6%, and the communication question misses a totally staggering 96.6%.
When you tally all that up, the survey methodology entirely misses 58.2% of individuals living with serious mental illness, over half. They are just categorized as non-disabled. So the really crucial takeaway for us here is that federal resources, grants, and public programs are all allocated based on this data. And right now, the data methodology is keeping millions of people completely invisible to the very systems that were designed to fund their care.
Which leaves us with this final, provocative thought to chew on. We started today by defining mental health as a hard-won civil right. We've looked at the massive gaps in healthcare access and employment. But ultimately, how can society properly fund and fix the mental health crisis if our federal surveys aren't even counting the people who need help the most? If you aren't counted, you aren't seen. And if you aren't seen, your rights simply cannot be fully protected. It's a powerful reminder that the fight for disability rights and mental health visibility is far from over. In a lot of ways, it's really about making sure our institutions finally open their eyes. Thank you so much for exploring this with me today.